Lisa, um, I have really a burning question here. I cannot just not asking you this question. And we are in global pandemic right now. And I really have this question and want you to answer about COVID-19. Did initially COVID-19 exacerbate disparities or not?
Absolutely. That's a very important question. And you're right, we are in the pandemic. And I do believe that COVID-19 does exacerbate disparity. Um, um, okay, so mm, with the COVID-19, um, as we know that it spreads from person to person, and with African American communities, Hispanic communities, Native American communities, they do tend to spread faster due to the fact that they do live in large um, group of families in many generations. Um, it's their culture, and we totally respect them. It's just that, with COVID-19, we were told to social distance, to stay away from people, try to avoid close contacts. But these families, they live together, um, makes it harder to prevent the disease from spreading. Also, with the pandemic in the beginning, a lot of um, facilities or healthcare has been um, closed, or they have um, not taking as many patients that they used to due to the pandemic. In the beginning, we're still trying to learn what COVID-19 is. So in that way, a lot of patients are scared to go outside of the house because they don't want to get COVID-19. So they delay their care for, their health screenings or their doctor's appointments due to those factors. Um, Additional financial is another issue with COVID-19. A lot of patients or a lot of people have lost their jobs, or they're scared to go into their job, and they would. So obviously they have the income is another issue for them. And if, you know, instead of spending on physician visits, they have to pay rent, they have to pay, groceries, and their everyday living, taking care of the family. So I think with that, it does, COVID-19 does exacerbate disparity due to those factors. Um, Transportation, again, is another issue. During the COVID-19, a lot of public transportation only limits certain amount of people on the buses, on the trains. Um, and I myself experienced that before when we had a really terrible snowstorm and I was taking a public transportation to go to work. I waited over an hour just to get on a bus. I have 4 or 5 buses pass me by because of COVID-19. They can't pack everybody onto the bus. So I think a lot of times that's do delay people coming in to see doctors, to see health care. Um, some people, if you wait over an hour for a public transportation, sometimes you just give up, right? Um, so those are a lot of uh, the things that we see during the COVID-19 pandemic. Um, some during the time, um, surgeries were also canceled due to the COVID-19 pandemic. Elective surgeries were canceled, only emergency surgery were done. So patients who with cancer um, may not have may not get the surgery that they need right away, which then delays care. Sometimes can um, cause progression of disease in those type of patients who have delay in care. So COVID-19 pandemic does cause a lot of issues in healthcare. Um, s- and I think with the patients, minority patients, low income patients, um, there was an issue for them as well as, maybe others as well. Um, Telemedicine visit was initiated when COVID-19 pandemic started. A lot of patients actually like that, not have to come into the facility because they were afraid. But sometimes it's difficult to do uh, visits over the phone because you really need to examine the patient, you need to see the patient, the physical touch that we were taught to do. Um, so I think COVID-19 did cause a lot of disparities throughout the pandemic. It did. Um, Hopefully, things are getting better with now the vaccines and monoclonal antibodies for the COVID-19 treatments. That we should be in one day be back to normal, and we'll see less of these delay in care for patients who need treatments or surgeries. Yes.
Very uh, good explanation, Lisa. Really, I could not uh, just pass by not asking you this important question. And I also remember from the very beginning, like pandemic hit everyone, us in healthcare, specialized in oncology, having different treatments. What are we going to do? Lots of meetings and um, conferences, all Zoom calls to think about what is next. So, what do we have to do? We do not want to jeopardize patients' care and make sure that they will continue to get the treatment that they do deserve. So some of the challenges were again financial impact, even in Canada, and I think across the world was really huge, and it impacted everyone, and especially patients. I mean, underserved population really had a very negative impact on them. So social workers were working so very hard to make sure that these specific population are being covered as much as possible. Some of the treatments we could, especially even in immunotherapy. So we moved the 3 weeks schedule to 4 weeks schedule. So patients did not want to come. So the treatment was moved to be monthly, sending their requisition to do their blood work ahead of time instead of coming to the cancer center one day to do the blood, next day come for treatment. So all these have been modified. So lots of rules and regulation we had to put in place in a very short period of time. Like we are talking about that very calm and without being nervous. But when that happened and it hit us, it was really hard, very complicated. What are we going to do? Because it wasn't just about our cancer patients, it was about everyone, health and safety of the world, actually. But as you mentioned, it has been managed as well as it could be, and we are in a very good shape right now. Things are really getting better.
Thank you very much, but you're absolutely right. In the beginning it was scary. No one knew what's going on. We had meeting after meeting. Everything was updated weekly, daily to figure out how we are going to manage treating these patients, seeing these patients, etc. So yes, hopefully, with the vaccine and the treatments for immunotherapy, I'm sorry, for COVID-19, um, things will start looking better.